Welcome. Today, I am so excited to be speaking with Emma Cooksey. I have been following Emma online for years, so I'm really excited for this conversation today. Emma is a writer, speaker, and patient advocate. She was diagnosed with obstructive sleep apnea at the age of 30 after more than a decade of unexplained health issues. You may know her as the host of the Sleep Apnea Stories podcast or her work with Project Sleep, which she's going to share more about today. And we're really going to be focusing on what doctors need to be listening for from the patient perspective. So Emma's going to give us some insights into all of that. And before we jump in, if you are a doctor or a healthcare professional who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And before we jump into the video, I'd like to invite you to get my free melatonin brand guide. Many of our patients are taking melatonin, and supplement quality matters. So you can get this brand guide at intrabalance.com/melatonin so you can know which brands are third-party tested and professional grade if you're considering using it in your practice. Okay, well, thank you, Emma, for joining us. And I'd love for you to share more about your background with the audience and some of the work that you're doing.
Sure thing. Thank you so much for having me. I've been watching a whole bunch of your interviews this weekend. I was binge watching them, and I love that your audience is physicians because that's who, I love to talk to and share my story with. So my journey kind of started in Scotland, which is why I have a strange accent. And I really went undiagnosed with sleep apnea despite going to lots of doctors all through my 20s. And I got my diagnosis at the age of 30 as a new mom. And then I just felt quite alone and isolated. I had this diagnosis, I was on CPAP, but I didn't know anyone in my life with sleep apnea. And so I started a podcast in my closet, so called Sleep Apnea Stories, really developing a podcast that I wanted to see myself. So I interviewed a lot of people about their own journeys with sleep apnea and the specialists that treat them. And I featured all the different treatment options and just really created community around having sleep apnea. And then more recently, I have joined Project Sleep, which is a wonderful nonprofit, and they are doing such great work around sleep health and sleep equity and sleep disorders. So one of the things we like to do is to just really raise awareness, especially within the medical community who don't specialize in sleep, so that hopefully people can spot people with sleep disorders a bit quicker. So yeah, I just love all things sleep apnea and delight to talk to you today.
Well, thanks so much for being here and for sharing all of that. And yeah, I mean, I fully am on board with your mission, as you know, because, I often speak about the fact that as physicians, we only get about 0 to 2 hours of
Yeah,
sleep education in med school, and all of our patients have to sleep. And people with sleep disorders are not showing up in the sleep clinic first. They're showing up
right.
in their primary care doctor's office, their GP's office, maybe at their pediatrician's office if they're a child,
Yep.
maybe at their psychiatrist's office. And so physicians and health practitioners of all backgrounds need to understand sleep.
Yeah, I couldn't agree with you more. That's why your work's so important.
And we have this connection with Scotland. You're originally from Glasgow. I actually lived in Glasgow as a child, so we were chatting about that. So that's a fun little connection there.
Yeah.
And so, but getting to the sleep apnea. So you said you were diagnosed at age 30.
Mm.
How did you get diagnosed? Like what were you experiencing? What prompted you to talk to your doctor? Did you see your GP first? I'd love to hear more about your story and your journey.
Yeah, so during my 20s, I would say that my symptoms of obstructive sleep apnea probably started during my teens and early 20s. But like so many people, they really flew under the radar because what I was noticing was daytime sleepiness. I was noticing morning headaches and definitely disrupted sleep and unrefreshing sleep. So no matter how long I slept, I still felt tired in the morning. But if you think about people, and especially teenagers and people in their young 20s in Scotland, there's a lot of, like going out at night with your friends. Everybody seems to be tired. Everybody seems to be in the same boat. So it never really showed up for me as a problem until I started my first job outside of university. So I studied law at university for 4 years. And in my early 20s, I got my first proper corporate job. And I struggled so much every day to stay awake. So the biggest thing for me at that point was daytime sleepiness, and that would show up in ways like I would be in my office and they would have a meeting after lunch and we'd all sit around this big boardroom table, and one of this it was a law firm I was working for, and one of the senior partners would ask for a volunteer to do a really boring job outside of the meeting, and I would just volunteer really excitedly because I had to get out of that room because my head was bobbing and I really was struggling to keep my eyes open. So it occurred to me that wasn't normal. So when I went, originally it was a GP I went to see in Glasgow, and they ran blood tests. So I said to them, I'm feeling really tired and sleepy all the time, and I don't feel like I'm sleeping well. And that was kind of all that I said, and nobody asked me any questions. So if there had been questions around my sleep, I would have said I had morning headaches that were really intense. I would have said I snored really loudly. I woke up multiple times a night to use the bathroom. I was clenching and grinding my teeth. I pretty much had every single symptom of sleep apnea, but the biggest thing for me was this tiredness, which I think can be so many things, right? Looking from the GP's perspective. So they sent away for lots of blood tests. And when they came back, they said, I remember the lovely GP sitting with me and saying, great news. There's really nothing we found. So it's not, I remember him saying it's not a medical problem, as though it's all in your head kind of thing. And so then that kind of led to, I did go to the doctor on and off, like over those 10 years that I was undiagnosed. And I did get diagnosed with anxiety and depression because the more this went on, the more I thought, well, if there's nothing medically wrong with me, then why am I so exhausted and so, feeling so low all the time? So, and not that I didn't have anxiety and depression, I definitely did, but there was this underlying problem that we never really got to. So then things came to a head. I'd moved from Scotland to Florida. I'd met my husband in Scotland and then I moved with him where he's from in Florida. And I became pregnant really soon. And so I was pregnant with my first child and I went to a primary care physician here because as soon as I was pregnant, I noticed this daytime sleepiness was so much worse. I felt like I was like constantly napping. And it just was really disruptive. Like I wasn't doing anything. I wasn't productive because I was just napping all the time and I just felt terrible. So even though I had an OBGYN, I went to a primary care physician and I said to her, I know you're going to say that I'm pregnant and that's why I'm tired, but that's not what it is. Like I feel as though, this has been a problem for 10 years and it's only worse now I'm pregnant. And so she said, I know, but you're pregnant. So maybe ask your OBGYN about it. But, so I didn't really get anywhere and I was getting quite frustrated because I felt like there was something really wrong with my sleep and nobody was really taking me seriously. So then 3 weeks after that, so I'd been twice. I went once while I was pregnant and then I went once after I had the baby and said it's still not better. And then they just kind of said the same thing, right? So 3 weeks after my latest appointment with my primary care physician, I was driving on a bridge with my new baby in the car, and I just had that feeling my eyelids were just getting so drowsy and heavy. And I just thought, like, I'm going to fall asleep, and there's nothing I can do to stop it. And so I had a big truck in front of me, and I just remember like trying to focus on putting a lot of distance between me and the truck. And I did have that momentary where I fell asleep and I woke back up and I was able to slam on my brakes and I didn't hit the truck. But that was for me what I needed to really fight for a sleep study. So when I got home, I was like really, like had the adrenaline pumping through me and I, had gotten such a fright just because it was the first time I'd had my baby with me and that had happened. And it just seemed really terrifying. And so I gave the baby to my husband and I said, I've got to go and call the doctor right now. And I called the office and I said I was, there when I was pregnant, and I was there like 3 weeks ago. And I really think there's something wrong with my sleep, and I need to go and be referred to somebody who knows about sleep. So that's how much I knew at the time. I didn't know that there were board certified sleep specialists or sleep clinics. I just was like, I need to go to a doctor who knows about this. So that was how I got my polysomnogram and I got my obstructive sleep apnea diagnosis. So I think that's really what drives my work, is the fact that not that much has changed really in the last, 17 years. I still talk to a lot of women who are having the same situation where they go to the doctor and they're told you don't have enough risk factors, or like they're not able to articulate their symptoms so that their doctor picks up on the fact that it could be an obstructive sleep apnea problem. So, yeah. So I think was the question, how did I get the diagnosis?
Yeah. Yeah. No, thank you for sharing all of that. And I think, I mean, there's a lot to unpack there, and there's a lot of really important information for anyone who's listening to kind of, take from this discussion. One is, really listening to the patient, right? Listening, you felt like you weren't taken seriously. Now you're diagnosed with anxiety and depression and all these other things, and none of the clinicians were thinking about sleep apnea or a sleep disorder. And again, I don't like to blame the doctors. It's a lack of training in that
Yeah.
area. And that's why it's so important to have, these conversations. But also it took what, 10 years from the onset of symptoms to your diagnosis?
Yeah. Which
Yeah.
actually is not that uncommon now that I've spent so much time building community with other people with sleep apnea. That's a pretty common thing that I hear all the time. And a lot of it is exactly what you just said, like that, not only do doctors not really receive a lot of training in sleep, it's also that patients have very low awareness. There's a lot of stereotypes around sleep apnea that, you know, it's really only older, overweight men that have this. So a lot of women find it difficult to get this diagnosis or to get the right referral to get the diagnosis. And I think a lot of it is the way that we explain our symptoms as well doesn't help. Like, it's not that it's the patient's fault at all, but because we don't know enough about it, we're just not thinking about sleep disorders, right? So even when I went to the doctor, I was trying my best to explain how I felt. But unfortunately, like, the really extreme daytime sleepiness would come out as tears. So I would sit in front of a doctor and just cry and say, I'm so tired, like I can't keep my eyes open, like, and I wasn't listing out all these different symptoms, right? So whereas if somebody had asked me, do you have morning headaches, like, which is a really common symptom of sleep apnea, um, nobody really asked me, like, did I snore? Was I waking up gasping? Because my answer to all of those things would be yes, but I wouldn't think to actually volunteer that information to the doctor. So I think it's kind of both sides, right? If we can get patients to articulate using the word sleepiness, I hear like there's so many words we can say: fatigue, exhaustion, tiredness, but really what happens often with sleep disorders is this daytime sleepiness, feeling that you could fall asleep, which is different from fatigue. You want to lie down and rest your body because your body's tired. So I think like sometimes just asking those questions about, do you feel sleepy during the day and how does that affect your day-to-day life? How does it affect you when you're driving? How does it affect you when you're taking care of children? Or whatever your job or might be. I think that's when people start to think, oh yeah, it does affect me and this is how.
Absolutely. Yeah, no, you're absolutely right. And, these sleep issues, they're a public health issue as well, as you were talking about driving, drowsy driving. I think about 21% of fatal car accidents every year are due to sleep issues, insufficient
Yep.
sleep. And like you said, if you're taking care of a child and things like this, like there's all these downstream effects. And I hear this a lot from women too, because sleep apnea can show up differently in women.
Mhm.
And it may look like depression, it may look like anxiety, or it may look like, oh, you're a tired mom, or you're just busy, and that's why you're so fatigued all the time. And it's easier for women to get dismissed, I think, with regard to their symptoms as you were. One thing I do recommend to doctors and any health practitioners is to actually have all of these questions in your screening form. So Emma listed out the morning headaches, grinding or clenching, the daytime fatigue and sleepiness, snoring, gasping arousals, disrupted sleep, all of these things you can ask in your pre-session questionnaires. And that way, if you don't have time to go into all the symptoms in a visit, at least it gets your patient thinking about those symptoms as well.
Yeah, that's a great idea. I feel like that's starting to happen a little bit. Certainly, like in terms of medical history, like I'm seeing sleep apnea and sleep apnea symptoms listed there more, which is great. But yeah, the more we can do that, the better. Because I don't think people connect the dots. A lot of these symptoms seem a little bit unconnected, right? I clench and grind my teeth seems really disconnected from I have this headache in the morning, but it all goes together when you know what you're looking at. But if you don't, it seems like a whole bunch of clues and
Exactly. And also the going to the bathroom a lot at night.
Mhm.
I'll hear that from people. Oh, I just drink too much water in the evening, and that's why. And they don't make the connection that that
Yeah.
could be a symptom. And for women, I'm curious to hear your thoughts, especially, with guests that you've had in your podcast and stuff. I'll hear from women that they'll like, I might suggest to them, hey, maybe we should get a sleep study. I think you might have some signs of sleep apnea that we should get tested. And they'll say to me, well, my husband has that. I don't have that. I don't snore the way that he does. Or, I don't want to wear that thing, referring to the
Yes.
CPAP mask, or they just might not realize that in them, the symptoms might actually look very
Yes.
different than it does in their partner.
I mean, that's what I spend all day talking about to everybody. That's so true. I think that the kind of one group of people with sleep apnea, the sort of older, overweight men who snore very loudly, they're taken to the doctor by their wife because it's such a disruptive symptom, right? Because it's disrupting, their bed partner's sleep. But with women, it can show up really differently. I mean, I was really saying that I think if somebody had asked me if I snored most of my 20s, I would have said no. And it's really only since I don't really think my husband said anything about it, to be honest, until I started doing this work. And, he overheard me kind of interviewing someone who said they didn't think that they could have sleep apnea because they didn't snore. And I was agreeing and saying, "Oh, I don't think I really snored either." And when I got off the call, my husband said, "Oh, you always snored before you got, treatment with CPAP, but, not so loud that it would bother him." So I think it just looks really different. So it's just important and I would say with the anxiety and depression part, like I've done really well with treating my sleep apnea and treating the anxiety and depression. But it is quite, I think for some people it's like, I mean, there doesn't have to be a reason you have anxiety and depression, but this feeling of, for me, it showed up first thing in the morning, I would gasp awake and feel really anxious, and nothing had happened yet. So I think like sometimes, yeah, just kind of digging into exactly when people are feeling certain ways, like can help you parse it out. But yeah, I don't envy doctors their job of having, like they've got every single thing possible to try and rule out. So yeah, some questions on an intake form would be a really good idea.
Yeah, no, definitely. And also, I mean, the advocacy work that you're doing is just so helpful to raise awareness both for the healthcare practitioners and for people in general, for the patients. And so could you tell us a little bit more about some of your work around that? Maybe I know you started your podcast. Maybe you could tell us about your podcast. And then I'd love to hear more about some of the other exciting projects that you have in store.
Yeah, sure thing. So my podcast thing kind of came out of I went on a trip to see my primary care physician, and this was years after I'd gotten my diagnosis and I'd been on CPAP for a long time, and I always felt a little bit, isolated and like I didn't really have any friends with sleep apnea. And I happened to be just going for a checkup at my, regular primary care physician. And I was stuck in the waiting room for a really long time. And I saw this article in a magazine in the waiting room that was talking about sleep apnea. So I kind of was like, looking through it, and a lot of it I was just thinking, yeah, I already know this. I'm already on CPAP. And then the last paragraph just kind of said, like, people that don't do well with CPAP, they can get an oral appliance from a dentist, or they can do all these different treatment options. Like, I think it said the Inspire implant and all these different surgeries. And I was like, I've never heard of any of these things. And so I listen to so many podcasts, and I just like, as a mother, like every time I'm cooking dinner or doing laundry or whatever it happens to be, I'm listening to a podcast. So I tried to find a podcast that would have more information on those things. And I just couldn't find really what I was looking for. And what I wanted to hear was stories from patients who shared their journey to diagnosis and maybe what kind of treatment option they were using. And I just didn't find that. So I thought, well, I wonder how hard it would be to start a podcast. So my kids were kind of like eye rolling about the whole thing, but I decided that this was kind of my project. I was going to start a podcast and do 10 episodes and see how it went. And so I was really pleasantly surprised that people that I asked to be interviewed on this fledgling podcast about sleep apnea agreed. So after I did the 10 episodes, I just carried on going. And so I actually just finished my podcast this last month, but I did 143 episodes over the last 4 years. And I had patients using every different type of treatment option. And I interviewed experts and dentists and sleep specialists and just all sorts of people that might be involved with treating sleep apnea. So it was just a really great experience. And then partway through, I realized how much bigger a lot of these problems were than one woman with a podcast. And I really saw a need for systemic change, and a lot like raising awareness on a much bigger level. There's so many people undiagnosed, and there's a huge lack of awareness. So a few years ago, I started getting involved with a group called Project Sleep, who are a nonprofit run by Julie Flygar. So she's the founder and CEO. She lives with narcolepsy and cataplexy. And I'd read her book. So she has a memoir all about Wide Awake and Dreaming, it's called, and it's all about living with narcolepsy. And I actually didn't really know anything about narcolepsy before I read her story. And I kind of really, even though we have a different sleep disorder, I really saw myself in her experience. And I had her on my podcast, and then we just became friends. So the more that I learned about what Project Sleep were doing, the more impressed I was. And I joined their board about 2.5 years ago to really help them, like go from being a tiny nonprofit to really starting to grow, which has been a really exciting time to be involved. So then part of it, at the back of my mind, they have a project program called Nerd Alert. And so if you don't know anything about narcolepsy, it's a great place to start. They have printable PDFs, which, like any doctors tuning in, you can go and download the PDF and print it out. And they have such excellent resources through that program. And so rather than reinvent the wheel, I decided we were able to get this program funded. And so I started working earlier this month as the sleep apnea program manager at Project Sleep. And my first program is called Sleep Apnea Squad. And it's based largely on Narcolepsy Nerd Alert. So we're starting with, the idea is to reach people wherever they are. So we start with a live broadcast on YouTube, and that then becomes a podcast. And then we write a really detailed toolkit, like a PDF toolkit, so that people can download that with all the information. And then we also share on social media. So we hope that the information gets to the people, that need it wherever they are. And so the format is going to be kind of like my podcast, in the sense that I'm going to be hosting these discussions, but we're going to have a patient perspective and a clinician perspective, which I just think is really nice, a nice way to address the topics, just because you get all the different perspectives. So yeah, people can find it at project-sleep.com. And then you go to get involved, and then Sleep Apnea Squad. And we've got a list of all the different live streams that we're going to do the next until May. So you can go and find it there. You can sign up for e-updates so that you can get my emails all about what we're doing. And I mean, we're really hoping not only to have patients tune in, but the people that are, clinicians that are seeing patients. It's a really great place to get easily accessible information about sleep apnea. So that's kind of the goal.
That's fantastic. I mean, it's so needed because, like you said, there's just such little information out there on all of these topics: sleep apnea, narcolepsy, and other sleep disorders. So I think this is a great resource. So for any clinicians who are listening, you can listen to Emma's podcast, Sleep Apnea Stories, and then also follow Sleep Apnea Squad and Project Sleep to learn more. And you can use these toolkits and refer your patients to them because patients are craving this type of information and it's not readily available, or the information that's out there, it's, a lot of it hasn't been vetted. And so this is good quality information. It's a
Yes.
reputable source for your patients.
Yeah, that's really we have a really great expert advisory board at Project Sleep, which is a really great group of we have patients, researchers, all different clinicians, like, a really great group that can review a lot of the stuff that we put out. So that's what I love about Project Sleep is just the high quality of the resources that you end up with. So a lot of the things that we're talking about seem quite basic. Could I have sleep apnea? And how do you get a sleep apnea test? But these are really the hurdles that are stopping people from getting diagnosed. So just being able to explain in our first session next week, our patient perspective is from Bob File, who is living with obstructive sleep apnea, and he's a former Major League Baseball player. So I think sometimes, he was told like you're way too fit to have sleep apnea. And obviously I'll be sharing a little bit about Mike's, and then we'll have Dr. Sam Kashani, who I know that you've had on your on your YouTube channel too. And he's going to share just all about how these symptoms can show up and show up differently in different patients. So I think it's going to be really helpful.
That's really great. So, so helpful. And you know what? Okay, I'm going to share something that I am actually getting tested for sleep apnea and figuring out that I have mild symptoms
Yeah.
because, it's not something that my doctor ever brought up, even though, I went to her to talk about, some symptoms I was experiencing. It didn't even come up in conversation. But me, as a sleep doctor, I have the resources. And I said, you know what? I'm just going to get myself tested. And lo and behold, that's something that now I'm figuring out. So I'm going to be following you too for your tips
Love it.
as I go into this treatment journey.
Yeah.
Um, so okay, so for doctors who are listening, one of the big objections we get from patients when it comes to treating sleep apnea is I don't want to wear that mask, or I just can't adjust to that. And I know you have a workbook guiding people through that. And then also with your work with Project Sleep, you're going to be helping people with this. But what tips or advice do you have around this?
Oh, how long do you have? So yeah, so the reason I wrote my 6-week CPAP solutions workbook largely because over the 4 years that I did my podcast, I was asked the same CPAP questions again and again and again. And there is a lack of patient education when it comes to using CPAP. So the first thing I would say, like with the people who just outright don't want to get tested because they don't want to go on CPAP. So for those people, I would always say, like, you want to know what you're dealing with, and CPAP is not the only treatment option. There are like a lot of different options, and you just want to see what you're dealing with first. Because whether it's mild, moderate, or severe, there are different treatment options dependent on that. And when it comes to actually adapting to CPAP, sometimes people just surprise themselves and out of the gate do just fine. And they're like, this is actually not that bad. And they feel better the next day. And that drives it. So I'm one of the people, another reason I started my podcast was that I'd heard a lot of those stories about patients who were like, oh, I felt terrible. And then I started CPAP and then I felt wonderful. So that's not my experience. My experience was I started CPAP and I struggled with a lot of problems that I now realize are easily solvable, right? So that's why I wrote my workbook, is just because, if I had known that having a well-fitting mask was half the battle. I would have, gone straight back the next week and said, this mask is leaking. This is a huge full face mask you've given me, and it doesn't fit my face. But I think because we don't know that as patients, we just assume that, whoever's fitting us for a mask, and these days a lot of times things are sent direct to us from online distributors. So that makes it even less of an interaction with a respiratory therapist or a sleep tech. So yeah, just knowing like this is what a well-fitted mask should be like. It should be silent. It should, you shouldn't have to tighten it really, really tight to get a seal. It should be comfortably like so that it's not leaking, but you don't really feel it pushing on your face. If you're waking up with huge marks, there's plenty of solutions for that. There's a number of different they're like strap mark or strap covers or cozies. There's a hose cozy that goes over your hose, and those are the kind of things that seem really small. But I've talked to people over the years who have said to me, oh, I had a CPAP, but I just couldn't get used to the hose making a weird noise against my bedside table when I would move around. So I abandoned it. And I'm like, put this cover on your hose and that fixes the problem. So there's things like that. And so one of the topics that was really important that I wanted to include in the sleep apnea squad kind of itinerary that we have, in January, we're going to be talking about making CPAP more comfortable. And that's all the different, comfort products you can get that are often, like $10 and it solves your problem. Talking about the different types of masks, like what sizes of masks and shapes and manufacturers, there's just such a huge variety. And I think also opening up that discussion that CPAP is not the only solution. And also that combining therapies is becoming like a really big thing. So for me, I'm in this super fortunate position where I had interviewed so many people, and I found that as I gained weight, I started perimenopause, I gained some weight, and I had to go back to my sleep doctor to have my pressure increased. And at the new pressure, I found it really uncomfortable. I found I was taking my mask off. It just wasn't going as well as it had for the previous, 15 years. And so I had interviewed somebody on my podcast who said that for her severe sleep apnea, she combined CPAP with an oral appliance together. And so the last year, that's how I've been sleeping is with an oral appliance and a CPAP together. And I was able to have a titrating sleep study to lower my pressure back down for when I'm wearing my oral appliance. And it's so much more comfortable. And so those are the kind of things that if patients just knew some of that in the outset, like it wouldn't seem such a challenge, right? And I think another part of CPAP is we're doing another session in the spring next year on shame and stigma, because I think a huge part of having sleep apnea, we've touched on, like women feeling like this is a thing for older, overweight men. And so that kind of affects your self-image a little bit. There's also this idea of how is my partner going to react to CPAP, or indeed people that are dating, how do they introduce that to a new partner? So I think there's a lot to discuss around that. And I think that, I don't know, like I find CPAP humor as funny as the next person. But I think sometimes, we kind of overlook that people are trying to do something good for their health. And I think that, there's already enough stigma around using CPAP that we could probably lay off the, making Darth Vader jokes and all of that stuff. It just doesn't really help.
Yeah, no, I'm so glad that's going to be part of your program, talking about the shame and stigma, because yeah, I mean that's a real issue for people, and it can really deter people from actually getting the treatment that they need. And but thank you for sharing all of those tips with CPAP, because I think even doctors, it's important for them to know it's not just a set it and forget it type of thing, where it's actually a process to get the right fitting mask. There's all these other changes you can make to the configuration and use all these, the cozies and all of these other things that can really make it more comfortable. And what I tell patients is that it's like finding the right mask is like finding a pair of shoes. it might feel okay at first, but then you walk out of the store and then it's pinching or it's rubbing. A mask is like that. It might feel okay in the lab, and then you go home and it's like it's not comfortable. So you can iterate and try different ones, and it's an ongoing process.
Yeah. And I think as well, like people underestimate the difference between different manufacturers. They might look similar, but just a really tiny change in the design goes from being uncomfortable to your dream mask. So I think a lot of it is trying as many as you can. And so whether that's, you know, using like an online supplier where you can have some of them have really generous return policies where you can try masks and return them within 30 days. And yeah, that certainly was part of my process. But the other thing as well is I think oftentimes people don't, there's this thing where I think sometimes, doctors don't have a lot of time, right, to spend with each patient. So I think sometimes they think that people are going to go home and read the whole manual when really people are not doing that. So I think it's just telling people, oh, the number of times I do a reel on Instagram or I post about, just your reminder to change your filter in your CPAP, which most people it's at least once a month it needs to be changed. And I always get DMs saying, I don't know what you're talking about. Where is this filter? How do I change it? So, it's just kind of like a lot of the stuff is not difficult. It's just that it's kind of falling through the cracks as to whose responsibility to tell patients it is.
Yeah, absolutely. That's why we need people like you who are, teaching patients, who are advocating for all of us, really. This is why sleep is so multidisciplinary. We've got so many different people on the sleep medicine team they're all important, and we all have different roles to play. And for any physicians who are listening as well, you can come join my clinical sleep kit program to learn more. And, we have conversations about how to navigate all of these clinical issues. And then you can also look at Sleep Apnea Squad to keep on learning and send your patients there as well. Emma, you have been such a wealth of information. There's, I think, so much more we could even go into. So maybe we'll have to schedule another time to go
I
into more
love
detail.
it.
Yes.
My favorite subject, if you
Yes,
haven't
I
already
know.
guessed.
Thank you so much. And, as we wind down here, what tips or advice would you like to leave our listeners with today?
So I would say for doctors especially, the more that you can ask questions about people's sleep, the better, right? Don't just assume that people are sleeping well. Like I think especially primary care physicians, if people are coming in, and especially women with anxiety and depression, it doesn't hurt to just ask about their sleep, right? And if you see some symptoms, please, please, please refer them for a sleep study because more women have this than you think have it.
Yes, absolutely. Have a low threshold for referring for a sleep study. And now with technology, the home sleep studies are much more effective than they were, like 15 years ago. So it's a lot more accessible now for people to get a sleep study.
I mean, that's definitely one thing, like you were saying, people that are reluctant to get a sleep study, telling them that they can do it in their own home and their own bed, and they don't have to go somewhere like that. Really, the idea of going to a sleep clinic does put off a lot of people. So I think at least as an initial screener, it's great to tell people that they could do a home test for this. And then my pet peeve though is when people get a negative result and then they just kind of go about their business, but they still have those symptoms. So that would be the time to really go back to a sleep specialist and ask more questions.
Okay, I'm so glad you brought that up because that's one of my pet peeves too.
Yeah.
Or the other thing that I'll hear from people is that, oh, well, I had a sleep study 7 years ago and they didn't find anything.
Mhm.
Well, it's like getting your blood pressure checked 7 years ago. It changes, right? It's not that one snapshot doesn't necessarily mean that you don't have it. And sleep apnea fluctuates from night to night,
Yep.
just like blood pressure fluctuates or blood sugar fluctuates.
Yep.
So if you have symptoms, it's worth continuing that evaluation.
Yes. If you, yeah, I think, yeah, that's one of the things that I say, like, I feel like I'm a broken record. But I feel as though if people have significant symptoms where they're getting to the point of getting a sleep test, just because a home sleep test doesn't pick up that you have sleep apnea, it could well be that like an in-lab test just tests so many more things. So, people can have multiple sleep disorders, or they could have, maybe they have restless leg syndrome or another sleep disorder which is disrupting their sleep, and that's why they're having daytime sleepiness. And a home tests are really designed to pick up sleep apnea. And really, I feel like their sweet spot is people with sort of a higher AHI, like more events, and sometimes people, especially women who maybe have like fewer events, and it's not as sensitive as having the full polysomnogram in a sleep lab. So yeah, please go back to your doctor if you have a negative test, but you really feel like you have symptoms.
Thank you for that. It was so important. And also for doctors who are listening, if your patient had a negative home sleep test, then you can send them for an in-lab PSG or consider longitudinal testing where you're getting multiple nights to get a closer look at what's going on. Such an important conversation. And again, it's a personal health issue for people who are dealing with these symptoms and these diagnoses, and then it's a public health issue as well. And so it's incumbent upon all of us to learn more and to support each other. So thank you, Emma, for joining us. Where can people find out more about you?
So I already told you guys a little bit about what I'm doing at Project Sleep. So the best place to go for information about that is right to the webpage. So project-sleep.com. Get involved, and then Sleep Apnea Squad. You can also sign up for e-updates over there. The other thing that people can check out is when they're at project-sleep.com, the Project Sleep website, you can also find details of the new helpline that they launched at the end of last year. And that is a place where anybody can call in, whether they are a person dealing with, like, they've got questions about their sleep, or they're dealing with what they think might be a sleep disorder, or indeed clinicians we've had call in to ask clarifying questions about where to refer people. I also like to mention to people that my podcast is still absolutely free, and there's 143 episodes available. So the best place to scroll those, you can access them anywhere that you listen to podcasts, any of the podcast platforms. But probably the best place to find all the details is on my website, is sleepapneastories.com/podcast.
Fantastic. So I'll put
Oh,
all of
I'm on
this.
Instagram too.
Oh yeah. What's your
So,
Instagram handle?
so yeah, I'm Sleep Apnea Stories on Instagram, and then you can also follow Project Sleep. It's project_sleep on Instagram.
Excellent. Thank you for those. And I will put all of those links in the video description underneath.
Great.
So everyone who's listening, please go and follow Emma on Instagram, follow Project Sleep, and check out the website, because these are all fantastic resources for your clinic and for the patients that you're working with. And Emma, thank you again. I really appreciate your time and your generosity today.
My pleasure. Thanks for having me.